Welcome back to Jersey Matters. New hope for those suffering from type 1 diabetes, also called juvenile diabetes. A man in Ohio says he feels cured after a brand new treatment that's still in the early stages of trials. But Dr. Jennifer Cheng, chief endocrinologist at Hackensack Meridian Health, says although it's exciting, let's not call it a cure. Doctor, thanks so much for joining us. This is exciting news. When you read the headlines about this man in Ohio that is now able, it seems, to produce his own insulin, they're calling it a potential cure for type 1 diabetes. Is that accurate?
Well, it is definitely exciting news, and thank you for letting me speak with you today. I'm very excited to say this is an exciting time for the treatment of type 1 diabetes. But unfortunately, I would not say it's a potential cure per se. It is a great way of treating it, type 1 diabetes in the future. So what this new technology involves is protecting the beta cells and producing insulin. For type 1 diabetes, as you well know, it is caused by the destruction of the beta cells in the islets of the pancreas. So the pancreas has islet cells and beta cells that produce insulin. That is what the type 1 diabetics are lacking. With type 1 diabetes, they can get a functional cure where they have to have this device in them where they are producing insulin and able to regulate their insulin function. So in terms of that, it is a great way to control their diabetes, but I would not say it's a cure yet.
And this is only one person, right? We only have one person. It still has to go through trials.
Yes, there has to be more clinical trials, and I think they are recruiting for the next 5 years. There's 1.5 million people with type 1 diabetes, and there would be likely a lot of interest in this, but they still have to do trials. They have to see how much this device can be in the system and in the body.
And we have to distinguish, because when people hear diabetes, a lot of times they don't even realize there's two types of diabetes. The majority of people that have diabetes are not type 1. Is that correct?
That is correct. So there is type 1 and type 2 diabetes. With type 1 diabetes, there is the destruction and the lack of insulin. So there's the destruction of the pancreatic beta cells in the islet of the pancreas. But there is type 2 diabetes, which typically is a resistance to insulin. Their pancreas is able to produce enough insulin. It's just not enough for their body. So they are still able to make insulin, but not enough. But eventually, even with type 2 diabetes, they may require outside insulin because they're not able to keep up with their body and they need the insulin. So this is a great way of getting type 1 under control, but not for the type 2 diabetics, because it would
never work for type 2. They wouldn't help to produce more insulin for type 2. This is specifically type 1.
Mainly for type 1 diabetes. Maybe it can be applied for type 2 diabetics in the future, but the underlying problem with type 2 diabetes is insulin resistance. They need a huge amount of insulin and their pancreas are just not able to keep up with it. So it would be harder to get the type 2 diabetics under control because they need more of those pancreatic cells. And with this new therapy, what it is it is implanting pretty much pancreatic beta cells in the body. So how it usually works is they put it inside the body, and it's a device that actually protects those cells from being destroyed by their own immune system. So even with the type 1 diabetics, it's not a cure because they still have the underlying cause that's attacking the beta cells. So if that device is not protecting the beta cells that they put in, the beta cells would still get destroyed by the body.
It seems like we're always on the cusp of a cure for type 1 diabetes.
Yes.
I've heard this talked about for years. If this isn't it, are we still on that cusp?
I think we're getting closer to it. It's very exciting, and I think we are getting closer to getting a potential cure, but I would not give them false hope and say this is the cure. There are a lot of new developments that need to be done to help find the cure for type 1 diabetes.
Is there one that you're excited about other than this one that hasn't been getting the attention of this gentleman in Ohio?
Well, I think that this potential treatment is is a good starting point. But there are other treatments out there that are looking at the underlying cause of type 1 diabetes and trying to prevent that immune destruction and prevent the destruction of the beta cells before they're actually destroyed. So getting to the root cause of the diabetes and preventing the destruction of those pancreatic beta cells to begin with will help prevent it and prevent them from actually having the effects from the type 1 diabetes. Once beta cells are dead, this is just a replacement of what is lost. So helping prevent it from happening in the first place would be the ideal thing to occur.
And that's what your problem is when they call this a cure, because it's not going to prevent anybody from getting type 1 diabetes. It's more of a treatment that can potentially, I guess you use, I don't know what the word is, but you can come up with the word, is a cure for people who already have it.
Yes, this is a treatment for diabetes. So for type 1 diabetes, it's an exciting treatment because this will prevent them from having to do injections in the future, so long as it goes through clinical trials and FDA approval in the future. But it is a very exciting time if proven to be effective. We have to see if this device can be implanted in the body and stay in the body for long term as well. We don't know how long these embryonic beta cells will last in the body too. And we don't know how much of that protective layer will last as well. They described it similar to like a tea bag, where the device is able to allow the beta cells inside the tea bag to release the insulin outside of the tea bag. And the tea bag itself is something protecting the beta cells.
Do we know if there'll be trials in New Jersey?
I am not sure about if they are trials in New Jersey or not, but I am not sure about that.
Yeah, I would imagine this is all fairly new, so they're
only on phase 1, so we still have to look at the data. It is very promising, but I would not call it a cure. And with our type 1 diabetics, I would say let's remain hopeful, let's get them treated. And for our type 2 diabetics, we have to go back to the mainstay of diet, exercise, weight loss, managing the weight, and decreasing that insulin resistance for our patients.
Perfect. That's a perfect way to end. Thank you so much, Doctor. I appreciate your time. Dr. Jennifer Cheng, Hackensack Meridian Health. Next on Jersey Matters.
I'm Phil Andrews, and coming up on Jersey Matters, we go Christmas tree shopping in Warren County.